In preparation for Charlie's surgery, when I was even still pregnant, I would ask a million questions about what's the process, what's the course of treatment, what are the surgeries going to be like, and getting as much information as I could. I hate feeling like things are out of my hands, and of course, I am not a surgeon and I'm not a cardiologist, so there was nothing I could do but get as much information as I could. And with that, it included a visit to the CCVCU floor to see what that looked like. We were able to see what a post-op child a few days post-op looked like. And I also researched pictures of what she was going to look like. And I think that helped me tremendously for being able to be strong and not be as shocked when I walked into the room to see her when she came out of surgery.
I just stayed by her side the night before, singing to her, praying with her. It is more so for me. And to keep me calm, I always had to stay positive. And that feeling of positivity, reflects with your baby. And that's how I dealt with Harmony in her surgeries. She had 7. And Harmony is about to be 2 years old. 7 before 2 years old.
The surgeon prepared me for a 5 to 10 day stay in the hospital. Now, in order not to get my hopes high, I just embraced the idea that she's going to be there for 10 days. I told everybody that my daughter's being in the hospital for 10 days and I'm not going to be available for the next 10 days. And basically, I was expecting the worst and hoping for the best. And at the end, when she was released after day 5, I was so excited because it was totally unexpected. During the actual surgery, when Malky was in the OR, the one and only thing I can say that kept us going was prayer. Because first of all, it distracted us from the worry, and also it gave us a deep sense of connection. We felt a tremendous relief and a great connection that kept us going throughout. When Malky was admitted for surgery, at that time I was actually beginning of my next pregnancy, and I suffered from severe nausea, and not eating was the worst thing I could have done to myself. So a little bit into the surgery, when I was into my prayers, I felt that I'm getting these hunger attacks and nausea attacks, and I knew that I won't be able to carry on much longer. So my husband said, let's go out and eat. And I'm like, no, you just can't do that. I mean, my daughter is under the knife and she's going through so much. How in the world can I go and sit down and eat? We actually went out to a kosher restaurant just a couple of blocks away. So while eating, we got the opportunity to connect and share our thoughts and feelings and encourage each other's. So it was actually beneficial physically and emotionally.